not start it or roll it out on 1st of May because the non-availability of vaccine.
सीरम इंस्टीट्यूट से हमारे अधिकारियों ने बात की, उन लोगों ने कहा कि साहब 15 मई तक तो हम जो हमारे पास भारत सरकार से पहले से ऑर्डर मिले हुए हैं उनकी आपूर्ति नहीं कर पाएंगे, तो आपको कहाँ से देंगे।
Hello everyone, good evening. You're watching News Epicenter with me, Marya Shakil. As the COVID crisis continues to escalate across the country, the only weapon that we have as a nation is the vaccination. But the 1st May vaccination drive faces a number of questions by the states. There are several states who are saying they do not have enough vaccines, there is vaccine shortage, the policy arrangement between the center and the states have not been worked out. More so, the vaccine makers are yet to ink any purchase order with various states. India is armed with 3 vaccines to counter the COVID surge, and the critical phase-3 of the rollout will take place on May 1st, where all those above the age of 18 will be eligible for the jab. Registrations on the CoWIN platform are open, but what is emerging just a few days ahead of the rollout is a red alert from the states complaining of an acute shortage of vaccines while witnessing a surge in the cases. Maharashtra, the epicenter of the COVID crisis, has said that it will not be able to begin the process from the 1st of May. Other states like Punjab, Chhattisgarh, Jharkhand, Kerala and Rajasthan have hinted at the same, saying that there is an acute shortage of vaccines, highlighting that Covishield maker Serum Institute of India has indicated that new orders will only get delivered after May 15th. Even as the rate for the states has been reduced from 400 rupees per dose to 300 rupees per dose. This comes as the centre has also highlighted that its vaccine stockpile is meant for the 45 plus age group, not for the phase 3, putting the onus of procurement on the states. An inoculated population is critical to tackle the virus. But even on the front, we are only inching closer to the 15 crore mark, even though the vaccine drive started in January. The question remains, are we ready to expand the rollout on May 1st? Is this infrastructure still unprepared to take on this mammoth yet critical task to fight the pandemic as the shortage of beds, medicines and oxygen persists? And is the Aam Aadmi who will continue to bear the brunt in this entire confusion? Let me bring in my guests. Dr. Navneet Wig is the HOD Medicine. He is the chairperson of AIIMS COVID-19 Task Force. We have Professor Dilip Mavlankar. He is the director IIP HG. Dr. Sameer Mehta is the vice chairman of Dr. Mehta's Hospital. Varun Kumar, is a resident of Patna. He is resident of Delhi who struggled to get a bed for his friend. I'm going to begin with you, Professor Mavlankar. Lot of questions unanswered. Many states are saying they cannot begin the rollout because the vaccine makers themselves are saying that we cannot provide the vaccines. My question is, will we really achieve what we are setting out for from 1st of May?
Marya, it's a very important question you have raised, and I have been also trying to explore what is the situation. What you said is right, that 1st of May is a formal inauguration, but many states may not have their part of the vaccine available, which is for the people below 45, because the vaccine producers are already committed to give their doses to the central government for those above 45. So that will continue, but some states might get by middle of May or 3rd week of May. So some activities might start by then, but we need to prepare quite well and see how fast we can roll it out once the doses start becoming available and reduce the vaccine hesitancy. Because what happened on 16th of January, we rolled it out, but there was so much of vaccine hesitancy in the medical professionals that the program went on very slow. So we have to prepare, even though we
Professor
may not
Mavlankar,
have...
this time Around, it's not as much about giving information to public at large that vaccines are safe. This is about shortage of vaccines. The fact is that for the last 3 weeks, multiple states across the country have been reporting about vaccine shortage. There are several elderly citizens, senior citizens, or those even who are above the age of 45 who have got the first jab. They are not able to get the second jab because the vaccines are not available. If this shortage is so rampant and it's not only being reported as an aberration from certain states, then what will May 1st achieve?
Yeah, that's what I said. May 1st is the nominal starting of the universal vaccination program, but very few might get vaccine on that day, wherever dose is available. The other issue, as I understand, and this is for the first time I'm seeing in the vaccine history in India, that half of the population gets vaccine from the state and half of the population gets vaccine from the central government. To my memory of 40 years in public health, this has never happened. First time we are doing this experiment of co-sharing and the vaccine costs. So we have to really think of how to make it seamless, where who is paying is not important,
Okay.
but the same citizen group must get vaccine when it is due.
Absolutely. Dr. Navneet, big answer this question. How does it work? Same set in this population, there are certain people who are being vaccinated by the center. Now the center has said that the states will have to procure their own vaccines. How does this sharing idea work? How will it work on ground?
You see, India is such a big country. When our first vaccination drive started, how much hesitancy was there? How much hue and cry was made? And look at the state of affairs today, where we have reached. So we have above 45. We have been able to immunize people and vaccinate them, and people are now willing for vaccination. Now wait for some time. I think we should give time to everybody. We should respect them, and we should not create a panic of shortage. But because ultimately, you see, what is the most important point today? Vaccination is part of the game.
Yes.
The other point is break the chain. What we are fighting is numbers. How we are going to break the chain? Masking. Are we strict on masks? Are we strict? Are our districts in the country keeping the numbers less than test positivity rate less than 5%? Are we able to do that? So each district has to keep their test positivity rate less than 5%. Only then we will break the chain, and vaccine takes 2 months to break the chain. So vaccination is important, but we must understand that masking is most important. Keep mask at home also, I would suggest. In current times, you see numbers have risen so much.
Since you are the chairperson of AIMS COVID-19 task force, help me understand what will be happening in All India Institute of Medical Sciences on 1st of May. Are you prepared to vaccinate those who will be registered on the COVID app? And in that age bracket of 18 and 45, have you got, when is the vaccine jabs likely to be delivered?
No problem. Everybody who is registered in the app will get jab on time. Please be reassured. So let us have faith in the system. India is a big country. My only request is please have faith in the system. Vaccination for 45, above 45 has been delivered, to elderly has been delivered, to frontline workers has been delivered, and now this will also be delivered, and it will be delivered.
Okay. Dr. Samir Mehta, here is Dr. Vig saying have faith in the system. So everything will be fine, although several states, let me name a few, who have said that they cannot start the vaccination drive from 1st of May because they have been told by Covishield maker that they will be getting their share of vaccine only towards later part of May, which includes states of Punjab, Jharkhand, Kerala, Rajasthan and Chhattisgarh. So does it mean that these states are ill prepared while other states will continue to scale up the vaccination drive? What do you think these states are not able to do which others may be able to?
Ma'am, I think it's a great question. The practical reality is nobody truly knows what's going to change on the 1st of May. I think we all fundamentally believe, let's take some facts, right? The vaccine is the single biggest defense against COVID that we know of, that keeps people outside ICUs and keeps people outside mortality. So I think the vaccine, taking a vaccine is the number one defense that you have. I think I agree with the doctors that have talked in front, things like social distancing, masks do make a big difference, right? And I think continue to do that because we need all the help we can get because India is complicated and big. But that being said, the private institutes across India have been told through the Association of Healthcare Providers of India that we will only get vaccines directly from the two institutes that are allowed, the Serum Institute of India and Bharat Biotech, 8 weeks after the 1st of May. So that gives us a huge degree of uncertainty. And in systems, you want assurance. For people, they want a little bit of, or in systems, you want predictability, but in people, they want assurance what is the right thing.
Yes.
I think we work quite well with the state. If we're honest about it, our Tamil Nadu state government has done a remarkably good job. And we should actually take hats off to some of the states that have done really well. We hope as India continues to learn, because India is tough. If I was sitting in the center and if you were sitting there, it's a really tough business trying to roll it out to 1.4
So what did Tamil Nadu do? Dr. Mehta, what did Tamil Nadu do that you're saying that they have done remarkably well?
So Tamil Nadu, even on its worst day, has vaccinated 4,000 people. On its best day is over 10,000 people a day, right? So the reality is Tamil Nadu government worked very well with a lot of these private hospitals, with the government hospitals, with the small nursing homes across Tamil Nadu and got them to be vaccination centers. So all of a sudden it allowed the access to vaccination to be hyper-local. And I think because Tamil Nadu had a great system, hats off to the state government that even during elections, they did a good job. And I think we should say that they did a good job. But that being said, do I know how many vaccines I'm going to get tomorrow from the state government? I don't know. Right? As a private hospital provider for my 2 hospitals in Dr. Mehta's or my 4,000 hospitals across Tamil Nadu state, does each hospital know how many vaccinations it's going to get each day? Does it know which vaccine it's going to get in the next 3 to 4 days? It doesn't have that visibility. So what we do is every day we have a list of patients and we say, guys, call us before 9 o'clock. We put a system in place so that it becomes a bit easier for us to predict our load, one. And the second thing is we give an assurance to a customer saying that if you took dose 1 on this day, exactly 4 weeks later onwards, we'll start calling you when we have vaccines and try and help you get the second dose as early as you can. That is the right thing to do. And if it's Covishield, is it an exact science that you have to take it exactly 28 days? No. The state and the governments have themselves changed the position that 8 to 12 weeks. So we say that, guys, from now week 8, we will start calling you saying that in the next 3 to 5 days, one of our hospitals, whether it's a partner hospital or a competitor hospital, it doesn't matter. Get vaccinated in a government hospital, in a private hospital, in a trust hospital, it really doesn't matter. Today, get vaccinated, but do it safely.
Okay.
And the problem is, in most of our states, a lot of people are panicking. Please don't.
Okay, we'll talk about panicking in just a bit again. But before that, let's get voices of citizens who have suffered. And Varun Kumar is a resident of Delhi. He struggled badly to get his friend admitted. The friend is now on ventilator. Meanwhile, friend's father passed away with COVID at home. Varun, tell us your story.
Ma'am, actually, I really respect for all doctors. जो भी इन्होंने कहा बहुत अच्छा कहा. As I listened, that doctor ने बोला था कि we have to faith on government, we have to faith on doctors. फेथ को मेंटेन करना भी एक बहुत जरूरी चीज है हम लोगों के बीच में. पिछले 10 दिन के अंदर मुझे मेरा फेथ जिसके लिए बात करी जा रही है कि हम अपने वैक्सीन के ऊपर विश्वास करें, हम अपने डॉक्टर्स के ऊपर विश्वास करें, अपने सिस्टम पर विश्वास करें, उसकी धज्जियां उड़ गई हैं. 4 दिन तक लगातार हम अपने फ्रेंड को लेकर के घूमते रहे जहाँ पे हमको एडमिशन चाहिए था, हमको ऑक्सीजन चाहिए था, हमको बेसिक नीड चाहिए थी, लेकिन हमको किसी तरीके कोई हेल्प नहीं मिली. 4 दिन बाद जब एट लास्ट हम अगर डॉक्टर अपने फ्रेंड की एक जगह पे एडमिशन मिला, हम उसे लेके गए तो उसे आईसीयू के अंदर एडमिशन मिला, एंड द नेक्स्ट डे उसके फादर जो सफर कर रहे थे पैरेलली, उसके उनके लिए भी हम कोशिश कर रहे थे, हमें जगह नहीं मिली। एट लास्ट घर पे वो रहे, रात को हमने उन्हें एक एम्बुलेंस के अंदर लिया, एम्बुलेंस में साथ में लेके गए, हम डोर टू डोर कई हॉस्पिटल्स गए, वहां हमें जगह नहीं मिली। एट द लास्ट बाय 4 o'clock मॉर्निंग उन्होंने घर पे ही दम तोड़ दिए। ठीक है, बट द नेक्स्ट डे इन द मॉर्निंग हमारे को उस आईसीयू से फिर खबर आ रही है क्या कि हमारा दोस्त आज वेंटिलेटर के ऊपर है। मैम इट्स वेरी इजी टू डिफाइन कि वैक्सीन से क्या होने वाला है। इट्स वेरी इजी कि हम घर के अंदर बैठ करके मास्क लगाएं, पर थिंग इज दैट कि जिस विश्वास की हम बात कर रहे हैं, जिस ट्रस्ट की हम बात कर रहे हैं, क्या वो मेंटेन हो पा रहा है?
Yes, this is the system that has let him down. Professor Mavlankar, for all those who may be saying have faith in the system, Dr. Big, you said have faith in the system, everything will be all right. Here is someone who's saying I had faith in the system, my faith in the system is shaken. Varun, how's your friend doing now?
No, he's not well. Even as per doctor's reports, you can't say perfectly next day हमारे साथ क्या हो रहा है, हम कुछ भी नहीं बता सकते. He's on ventilator. Last 3 days से उसे होश नहीं आया है. ठीक है, फैमिली तो सफर कर ही रही है, और एज यू नो फादर उनके जा चुके हैं, और टिल टुडे उसे अभी तक नहीं पता फिर उसके फादर के साथ क्या हो चुका है. और ये एक स्टोरी नहीं है. अगर मैं नंबर ये एक स्टोरी नहीं है. ये अगर मैं पॉइंट्स की बात करता हूँ, अगर फिगर्स की बात करता हूँ, तो एज आई नो अराउंड 3300 डेथ हुई हैं आज इंडिया के अंदर. तो ये 3300 स्टोरी है अपने आप में. एक ये 3300 ऐसे लोग होंगे, जो 3300 फैमिलीज है जो ऑलरेडी सफर कर चुकी हैं, और आज 33,000 से ज्यादा फैमिली सफर कर रही हैं. और फिर उसके बाद अगर गवर्नमेंट या डॉक्टर,
will you tell him to have faith in the system? Because these numbers that we keep talking about every day, these statistics are families. These families have been destroyed.
So,
you know, so it has hit individuals, families very close.
Absolutely. So the whole system is overstretched. Healthcare system is so overstretched, overburdened, it is difficult to imagine. It is difficult currently to admit patients. This is happening in Delhi. If you see, positivity rate was 1% on 1st April. On 20th April, it was 36%. So in 20 days, it has risen to 36%. Such has been the phenomenal rise in number of patients. And similarly, beds have not been increased to that extent. That is why people are suffering. That is why, again, I'm saying we have to break the chain. Delhi government has imposed super restrictions. These restrictions were must. Even after these restrictions, we are not able to decrease the number of patients. Yesterday, again, 24,000 patients in Delhi. We peaked to 35,000, but after 10 days of severe restrictions, we are only able to bring down to 24,000. So out of these 24,000, at least, you know, if every day 24,000 comes up, 10% of patients will require ICU admission. So every day 240 patients if requiring ICU patients, then these much number of beds over last so many days have not increased. So it is a war. We have to win this war, and it has to be win collectively.
War. Tell me, what was this entire system that you keep talking about did in the last 8 months?
So that
wasn't it about capacity augmentation? What did the Delhi government do?
So for that, please you ask Delhi government.
Why? No, sir, my specific question is, there are statistics to show that states after states shut down their COVID care centers and these centers which were established for patients because they thought that we are living in a post-COVID era. So there was complacency at multiple levels. As much as we talk about citizens to have faith in the system and say that wear mask, it's also the system which is letting these people question their own faith in the system. So that's where it's becoming even more difficult.
Absolutely. That is why I'm saying, please, at district level, we have to have perfect governance. It is suppress and lift. When numbers came down, then you lift it. When the moment they go up, just suppress it. This is not a one-time phenomena. It is 1 year, 2 year, 3 year phenomena. It will take a long time to suppress and lift strategy. Will have to be in place. And all these things, when numbers come down, how we will open up, and when numbers go up, how we will suppress, these things have to be clear. And these things have to be
Dr. Sameer Mehta,
earmarked. And
you
again,
know,
I am
one
saying
report is
my
suggesting,
request
Dr.
is
Sameer
my
Mehta.
request is to listen to everybody. Will have to participate. Everybody will have to participate. If somebody is not wearing mask, I have to ensure he wears a mask. Otherwise, this is not going to stop.
Yes.
Even families at home, we know the whole family is getting affected. Please wear mask at home. Don't be negligent. Even 0.1%.
Fine. Dr. Sameer Mehta, yes,
And it is not easy.
I get your point. I get your
And it
point
is not easy.
completely.
Young person,
I get your point completely.
young
Dr.
people.
Sameer Mehta, while we keep on saying don't panic, there are numbers which are telling people stay at home. The statistics are worrying because every now and then you get distress calls of people who want ambulances, who want hospital beds, who need remdesivir because hospitals are saying procure your own remdesivir, and then this entire vaccination drive which is going to begin. My question is, there are reports suggesting that the vaccine centers are also perhaps very close to the COVID care centers, and that is the reason why people who are getting the jab and they are immunocompromised, they need more care.
That's an interesting insight, and I probably agree with that today many of the vaccine centers are dependent on the same hospital systems, inpatient systems that are treating COVID. And I wish there was a different answer, but India is not a developed country in that way, but even the top developed countries don't have a difference in this. The same centers are giving the vaccine as administering in many cases it differently. Now, the exception to that are places like America where clearly you're getting your vaccine jab in supermarkets. Would you trust the hygiene of most of the supermarkets or kirana stores? I think that's a question that we can ask for somebody else. I think when we say don't panic, we actually mean something different. So let's clarify. Today, when people panic, they're buying oxygen cylinders, they're buying oxygen concentrators, they're trying to go to the black market and buy remdesivir because they think it's a wonder drug. And the people that are doing this are not just average middle class people like most of us, but they're also some of the extremely wealthy people who are worrying about their own loved ones. And that's a very realistic expectation. I think you can't ask them not to panic that way, but is it helping any of us? So if there is less remdesivir for doctors who are familiar prescribing that protocol to continue prescribing remdesivir to save patients, is it better that they don't have access to it? Absolutely not. So when we say don't panic, what we actually mean...
While we talk about hope, I understand. You're talking about hope, precaution, care, all that is fine, but there are stories. And I'm going to get you another story. Rajiv Suri, he lost his brother. Rajiv Suri, tell us your story.
मैम लास्ट वीक जो मेरे ब्रदर इन लॉ थे वो कोलैप्स हो गए. बड़ी मुश्किल से उनको हॉस्पिटलाइज किया गया था, लेकिन अब एक हफ्ते के बाद मेरे 7-8 फ्रेंड्स, क्लोज रिलेटिव्स जो कि नर्सिंग होम्स और घरों में इस चीज को सफर कर रहे हैं. हर किसी को ऑक्सीजन की जरूरत है, किसी को ऑक्सीजन नहीं मिल रही है, मेडिसिन नहीं मिल रही हैं. हॉस्पिटल में जाओ तो डॉक्टर्स बोल देते हैं कि ऑक्सीजन का हमारे पास कोई अरेंजमेंट नहीं है, ऑक्सीजन अगर आप अपनी लाएंगे तो हम आपको एडमिट कर सकते हैं. सुबह से लेकर रात तक सारा दिन ऑक्सीजन के लिए धक्के खाने पड़ रहे हैं. ऑक्सीजन का कहीं कोई अरेंजमेंट नहीं हो रहा है, ब्लैक मार्केटिंग हो रही है, सारा सिस्टम जो है वो कोलैप्स हो चुका है. ना मेडिसिन कहीं पे मिल रही है, ना कहीं पे ऑक्सीजन मिल रही है, ना कहीं पे वेंटिलेटर मिल रहे हैं.
स्थिति और आज की स्थिति में कुछ फर्क आया है इन टर्म्स ऑफ योर ओन एबिलिटी टू गेट थिंग्स फॉर योर फैमिली?
आज 8-10 दिन के बाद जो पोजीशन है और वर्स्ट हो चुकी है. आज से 8-10 दिन पहले जो पोजीशन थी, आज उससे ज्यादा वर्स्ट कंडीशन में हम लोग खड़े हैं. आज कहीं भी रूम नहीं है. आप हॉस्पिटल्स में जाइए, पेशेंट जो है सड़कों पे पड़े हैं, स्ट्रेचर्स पे पड़े हुए हैं.
Professor Mavlankar, I have exactly 20 seconds for you.
Yeah, I think my main point is we had a very ramshackle system and it has collapsed because of our lack of investment in healthcare. We have been only investing 1% of GDP where we should have invested 3 times. And this is the time of reckoning, and we must increase our investment and immediately think of measures which will save people. If we can't provide oxygen, if we can't provide bed, what kind of system is this? Of course, it's a major pandemic. So besides that, we have to think of people lockdowning themselves voluntarily in their own houses using double mask. That is my only message in last 20 seconds.
All right. Thank you so much for joining us, Professor Mavlankar, Dr. Vig and Dr. Mehta. And thank you to Varun and Rishi for sharing their stories. That's all from me. Thanks so much for watching. But before I leave, there is a message for you so that you can contribute and make change in somebody's life. Vedika is a 9-month-old baby. She has been diagnosed with spinal muscular atrophy type 1, which is a serious genetic disorder that usually kills babies before they turn 2. Your small contribution will help Vedika get some cure and perhaps survive. You can donate by visiting milab.org/Vedika. That's all from me. Thanks so much for watching.